This drives me crazy about modern day orthodontic treatment, not focusing on airway space and airway health. I feel like orthodontic treatment can be really summarized into 3 different pillars. So jaw alignment, making sure the jaws are in the right place, tooth alignment, and also airway space. We're really good at focusing on the first 2, but not on the third. So what is airway space? It's the amount of space in our nose and in our throats to get air down into our lungs. When we have narrow jaws, then we have a narrow nasal cavity and we're supposed to be breathing through the nose, and so it's harder to get air down and into the lungs. So when orthodontics takes into consideration airway space, they're not only going to look to align the jaws and straighten the teeth, but also get the jaws wide enough to increase the nasal space, to increase the throat space, so that air can easily get through the nose and into the lungs without restriction. If we don't address this early, then we can be setting up patients for sleep disordered breathing down the road because they're not going to have that space. And as they become full-grown humans, another reason why you need wider jaws is to create space for the tongue. The tongue is a large muscle that connects all the way down here, and when it doesn't have enough space to rest on the roof of the mouth, then it's more likely to fall back into the airway, which makes it smaller and contributes to things like snoring. And snoring means you're not getting enough air into your lungs, you're going to get poor quality sleep, and this long term can be disastrous. But we need to focus on addressing this early at a very young age. Newborn, 4, 5, 6 years old, we need to identify these issues and support them to create more space so that we don't deal with this problem down the road. So orthodontics is not just about straight teeth or proper jaw relationship. It is about sleep and airway space and quality of life. And I want to see a shift in the education in dental schools and orthodontic residencies to focus on this, integrate this third pillar so that we can generally address these airway issues. So there's not these little pockets of airway dentists, airway orthodontists. It needs to be generalized knowledge and how we approach orthodontic treatment.